Hello, everybody. Thank you so much for joining us. Well, we are here with Gonzaba Medical Group talking about a very important topic. We hear it on the news. We open up our Facebook and social media, the COVID-19 vaccine. We wanted to bring some special and important information to all of our patients, especially those that are joining us on social media. And today we have two very special guests, Precinct 2 County Commissioner Justin Rodriguez. So glad to have you here. A great friend of the Gonzaba family, a great friend of our city, an incredible leader. Thank you so much for being here. And we also have Francine Pina is our communications manager at Gonzaba Medical Group. Commissioner, we'll start with you. Thank you for being here.
Yeah, thank you so much, Erica. It's been just a long relationship with, first of all, with you and your family and the friendship, but the Gonzaba Medical Group and all the great work that you do in our community. So I'm happy to be joining you today.
Thank you so much. So, Commissioner, we'll get right to it. Our Facebook, our phone calls, we're just getting inundated with questions about this vaccine. Hot topic right now. How are they being distributed right now in our city?
Yeah, well, thanks again for having us. And we're getting the same questions here. As you know, Precinct 2 is about 500,000 people, a lot of seniors. I've got the west side of our community, but really countywide, we're getting a lot of interest in people getting vaccinated. They want to know how do they get the vaccine in a fast and a safe manner. So it's a little bit complicated, but I'll explain in the easiest way I can. The vaccine is essentially being distributed from the top down. And so when I say the top, it's coming out of Washington, out of the CDC, Centers for Disease Control, is kind of I guess the gatekeeper for the vaccine. They are distributing it to individual states. And so it's going from the federal government to our state government here in Texas. And then the state, the Texas Commissioner of Health, is then deciding here in Texas what counties, what cities, what communities are getting a certain amount of vaccine pretty much every week, right? So it's a little bit multi-layered. I know it sounds very convoluted, probably not the most efficient way to do it, but that's the program as the way it's being rolled out now, is that it's coming basically from DC to our state government in Austin, and then the state government is deciding how it's getting distributed to communities like County in San Antonio.
Okay, you're informing me already. My mind is like blown. That's amazing. So once it gets here to Bexar County and San Antonio, who's first on the list? How is that?
Yeah, so what's happened, and this has been going on here now in San Antonio and Bexar County for a couple of weeks, is there were some guidelines that the CDC put together. The Texas Department of State Health Services then interprets those guidelines and says, okay, for the state of Texas, this is what we're going to do. And they basically have grouped people into different tiers. Phase 1A, you hear often 1A, 1B. So what is that, right? So phase 1A, which is also called tier 1A, are really those frontline healthcare workers, right? They were the highest priority, and they still are, right? They're not all completely been vaccinated yet, but those are, you think of our healthcare workers, you think of those who work in nursing home or long-term health care facilities, our EMS workers, home health care providers, school nurses. So those are the groups, those are the folks in group 1A. They have been vaccinated now for, I think, a couple weeks. What's happened though is as people are finishing up getting those 1A groups vaccinated, you don't want any lag time. And so there's some providers that have started to vaccinate what's called group 1B or phase 1B. Those are probably some of the folks that are watching here today. Those are our seniors, those that are 65 and over in our community, A, and then B, those that are younger than 65, but that may have some underlying health condition, right? They may be diabetic, they may have hypertension or heart disease. So those are now the phase 1B are folks who are now getting the vaccine. You may have seen that in the news, and I'm sure it's piquing a lot of people's interest because we do have a lot of seniors here in Bexar County. Of course, we have a history, not just myself, but a lot of leaders here in Bexar County put their money where their mouth is. We take care of our seniors. And so that is the group that is now being vaccinated in selective clinics and the healthcare providers.
Absolutely. So speaking of providers, we've seen on the news that there's lines at hospitals and people are lining up and calling and trying to get on wait lists. So who are some of these providers that are administering this vaccine?
Yeah, so the one that I have the most firsthand knowledge of is University Health, right? That is our hospital system that has historically been known as Bexar County Hospital System, right? It goes by the name University Health System, or UHS. So I have the most knowledge about that because of their relationship with Bexar County. So UHS, you may have seen this week, I was out at Wonderland Mall with Bexar County Judge and Mayor Nierenberg. They started on Monday. They started with some of the vaccines for that, again, that tier 1B group. But there's also others, right? There are other clinics. There's other, HEB, I think, is starting to get some vaccines, CVS, Walgreens. So basically any kind of healthcare provider that is licensed to possess and administer the vaccine, they've started to get, they may not know how much they're getting. That's that's a tricky part, is that, they may not know until, the UPS driver appears on their doorstep with the vaccines. But I understand too that, and maybe you'll have information later, that our friends at Gonzaba are also going to be one of the administrators. So there's a number of different healthcare providers that are doing this. It's not just in one location or another. What I would encourage folks to do is, make sure they check with their healthcare provider, either their doctor or where they buy their pharmaceuticals, to see if they're available in those particular locations.
Right. So that, I mean, you just said it right there. How do you sign up? Call them, check with the university as well. And so speaking of one of those providers, yes, we've got Francine Pena here. She's the communications manager with Gonzaba. Francine, Gonzaba has the COVID-19 vaccine, correct?
Yes, so Gonzaba Medical Group has been approved to be a COVID-19 vaccination site. We did administer our initial supply of vaccines already, following the guidelines as the commissioner stated, with that tier 1A and vaccinating our healthcare workers, our frontline workers. So we have used that supply in its entirety, and now we are waiting for our next supply to come in, so that way we can start vaccinating that tier 1B that was mentioned. But yes, we are on the list to be a vaccination site. We are just patiently and eagerly waiting to receive them.
So I know a lot of patients are calling and they're saying, do you have the vaccine? Do I need to make an appointment? Once we do receive it, what level, or what is our process for who can receive this vaccine?
So we're actually bound to follow the guidelines that are set forth to us by the Texas Department of State and Health Services. So we follow the same guidelines as everybody else, vaccinating tier 1A, followed by tier 1B. Again, those are the healthcare workers, and then anyone 65 plus, which is the majority of our patient population, and then anyone 18 and older who has an underlying medical condition. Now, there are certain people that will not qualify for the vaccine. So we're saying if you tested positive with COVID-19 within the last 90 days, it's recommended that you don't receive the vaccine. And if you've received any other vaccine within the last 14 days, we also recommend that you do not receive the vaccine. Some of the questions we received is, I received my shingles vaccine. Can I still get the COVID-19 vaccine? So any vaccine that you've received within the last 14 days, you should wait to receive the COVID-19 vaccine.
Right, and absolutely continue with the masks and social distancing and following all of the guidelines. Folks, a lot of people are saying, this is a bunch of, this is news, it's media, it's a hoax, it's not real. This is very real. I can say that everyone on the screen probably knows someone that has contracted the COVID-19, even passed away. It's something serious, and it's very important for us. So Francine, once we do get the vaccine, what do our patients, specifically Gonzaba patients, have to do to get that vaccine scheduled?
That's the beauty of Gonzaba Medical Group. Our patients won't have to do anything. We will be reaching out to our patients as soon as we receive the vaccine, scheduling appointments. We will call them, schedule their appointment, and they can come in a very orderly, organized, efficient, and smooth process for them. So when we get the vaccine, we'll be scheduling those appointments. They don't need to call us. We'll call them.
That's wonderful. Commissioner, again, thank you so much for being here. Is there anything else you'd like to add?
Yeah. Thank you, Erica. The only thing I'd mention too, because again, we know that this is very dependent on when the providers get the vaccine. I know at University Health System, there is a very useful website you can go to. It's wecandoitsa.com. You go on there and you can actually sign up for notifications when vaccines come in at UHS. They do a very orderly scheduling of vaccines. That's what's going on at Wonderland this week. So once they get more vaccines, you'll be notified when you actually can sign up for your vaccine, hopefully as soon as next week. So I know we're all trying to get through this together. I think to the credit of our community, folks understand and appreciate, and I think are following the guidance of our public health professionals, our doctors, who say this is a safe vaccine. It's going to make our community safer. So we certainly encourage everybody, particularly those who are eligible now, our seniors, to go ahead and get the vaccine as soon as possible.
Absolutely. And I think right now the main message is to be safe, be patient. You know, everyone is working diligently to make sure that our communities just continue to get healthier, and we, as they say, you know, get rid of the curve. Let's get rid of the curve. Let's try and keep everyone, you know, safe and healthy here in our city, especially in Bexar County. So thank you so much, Francine. Any last thoughts? Or, you know, Gonzaba is working really hard.
Yes, we are, and we're here for our patients. We're here for the community. We do have a COVID-19 page on our website, so if they wanted to visit our website to get more up-to-date information, we have plenty of information there as well.
Okay, great. Thank you so much, Commissioner. Again, it's always a pleasure.
Thank you.
Thank you,
Erica.
Thank you so
Take
much.
care.
Thank you all very much. Again, visit those two websites if you'd like some more information. Thank you.